Hey, Dr. Shakib here from Irvine Spine and Wellness Center. I'm going to talk to you about the knee joint and the stretching that you need to do. So before we do that, you need to first understand a little bit about the knee joint itself. It's a very tight joint. As far as I'm concerned, it's a very unforgiving joint, meaning if you hurt it, it's very easy to have a scar tissue, and then the presence of scar tissue becomes the actual issue. So stay tuned and watch the rest of this video. All right, let's talk about the knee joint itself. If this is the knee joint, and this is your thigh bone, and this is your leg bone, which is actually two, but for the sake of this conversation, we'll talk about the joint itself. There are ligaments and that are stabilizing the actual joint. So the inside of your knee joint is the collateral ligament. The outside is also collateral ligament. The function is to make sure the knee joint's not going like that, so it kind of stabilizes it that way. Then you've got the cruciate ligament, which are anterior and posterior, so they prevent the knee joint from going too far forward and too far backwards. And then you've got the actual meniscus, which are on the surface here, and that's more like a cushion, yeah. So it's not bone on bone essentially. So it's very easy to damage any of these ligaments or the meniscus for that matter. And so you first have to understand, for example, if you have an inside of your knee pain, that could be because there is potentially there is a meniscus issue, or there is a medial collateral or inside collateral ligament issue. Maybe it's overly stretched on the inside of your knee, that ligament over here that connects this to here is stretched, so it's not stabilizing it, and then it could be it's just a matter of time before it causes pain on the opposite side. Now, if you're having pain essentially in front of your knee, that could be a cruciate ligament issue, or it could be what's called chondromalacia patella, which is the softening of the kneecap. So that's essentially the anatomy of the knee joint, a very brief description of the anatomy that you should be aware of. And then there are tests, different ortho tests that we do in the office to determine exactly if this is a collateral issue or a cruciate ligament issue, or if it's a meniscus issue. They're pretty simple to do. I'm going to see if I can do like an exam, a knee exam, and do a video on that. But anyway, I see so many knee issues in the practice that I thought I should just kind of go over the very basic structure of the knee joint itself, so you better understand where your knee pain is coming from. Hope that this helped you. If you have any questions, don't hesitate to contact me with one of the contact information I'll put in the description box. Make sure you subscribe to my YouTube channel and follow me on my Facebook page for Irvine Spine and Wellness Center. Remember, you are the designer and the director of your own life, so design and direct it the way you wish to live it. You are in charge of what happens to you, so make sure you educate and empower yourself with information so you can have an easier life. Take care.